So Voranigo is a 40 milligram tablet. It comes in 40 milligrams and 10 milligram tablets. 40 milligrams, I think, are for those who are 12 years or older. I think one of the biggest challenges that we're going to have as a neuro-oncology community is that this is an open-ended daily medication. And radiation may last 5 weeks or 6 weeks. Chemotherapy like temozolomide might last a year. Chemotherapy like procarbazine and CCNU might last 9 months. And so we sort of know when the end is in sight. And that's not true for this Voranigo. We don't really know how long patients need to be on it. It's really open-ended to see how things are going. Of course, safety first, but also as it relates to the benefits. I think this medication also seems to take some time to work. It's not necessarily like radiation or some other chemotherapies. Is it a chemotherapy? It's a good question. I think it depends on how you define that. I think we consider it a targeted agent, but it does require lab work. For the first 2 months, we need blood work every 2 weeks. And then for essentially the open-ended amount of time, you need blood work about every month. So it is laborious to have to go to the lab every month for an open-ended amount of time. Over time, maybe we'll need to do that less often, but for now, that's what's being recommended for at least the first 2 years. And then MRI scans. So, needing to check in, see if the medication's actually working, assessing the seizures to see if the seizures are getting better or getting worse, and if whether there's a response on the MRI. Some people do benefit from shrinkage. Some people's tumors have actually decreased over time and stabilized. But again, this is not something that we think at this point is a cure. So we definitely have to continue to monitor things and work together with your neuro-oncologist about how long to stay on these medications, how long to wait to see if this medicine is going to work. We do think that this medicine doesn't work for everyone. A lot of questions that we still have that are unanswered. Really, the biggest side effect that is pretty consistent is the liver. And unlike most of the other chemotherapies we use, where we more are worried about the blood count, so immune system getting low or the platelets getting low, this really does seem to have an effect on the liver. For that purpose, for the first 2 months on treatment, that you need to assess every 2 weeks, the liver tests, as well as the rest of the blood counts. And then over time, if you aren't seeing those effects, then you can check the levels a little less often. Some patients may need to have these medications held because their liver tests are getting high. Some patients may need to have their medication reduced, the dose of it reduced. And that's fortunately why it also comes in those little 10 milligram tablets and not just the 40 milligrams, because you're not supposed to cut it or crush it. Fortunately, what they have saw in the clinical trial is that most of these liver effects were reversible. So you held the medication and things sort of got better on its own. But this is definitely something, as we start using this in a lot more different types of people who are on a lot more different types of medications, it's going to be something that we have to monitor very closely. COVID-19, this clinical trial was actually all conducted during COVID-19, but this drug doesn't increase the risk of COVID-19. Some diarrhea, some headache, fatigue. I think as is true with so many of these medications, even seizure medications, it takes a little bit of time to get used to these medicines. But these are pretty common side effects that we saw even in the placebo arm, and are pretty consistent with side effects of other medications. So hopefully things that can be managed. But really the liver tests are one of the major concerns. So again, the hepatotoxicity, so you have to kind of monitor very closely for the liver. Thinking about drug-drug interactions, there are some particular pathways that are through the liver that can interact with the vorasidenib. Yeah, I think actually Paxlovid, for example, with COVID is actually one of those medications where you have a drug-drug interaction. So be sure that as you're thinking about medications, new medicines, over-the-counter medications, supplements, all of these things really need to be discussed with your neuro-oncologist. There's also drug-drug interactions with some, not a lot, but some seizure medications too. So these are really things that need to be very well laid out and discussed with your neuro-oncologist. And tobacco actually, it may have an effect on the benefit, or too much of the medication may actually end up in the system in use with tobacco. So that's actually in the FDA label, is that recommend non-smoking. And then I think one of our biggest challenges is going to be as it relates to family planning. And again, these are patients just like those 4 patients I mentioned at the beginning, parents, young parents, early in their careers, and sort of trying to figure out how to navigate this open-ended medication in people who are often in the time of their life where they may be thinking about continuing their families. And this is a medicine that does seem to decrease the effectiveness of hormonal contraceptives, so birth control. So that's going to be something that really needs to be discussed with your neuro-oncologist. We don't have any human experience with the effect of this medication on a fetus or a baby, but we do have animal studies that show that there's embryo fetal toxicity. So miscarriages and early effects of the growth and stuff like that. Really carrying a child and being on this medication is going to be something we really have to think about and of course have to plan for. It may affect fertility with temozolomide, for example, as a medication that once we often get it out of the system, then people are able to have healthy families. That may not be the case necessarily in this medication. And so this may have an impact sort of longer term, even if you come off of the medication for men and women. And so again, kind of making sure that discussions about fertility preservation before you're starting treatment and thinking about alternative ways to conceive families are going to be a part of this journey. And Servier does have some resources on their website that may be helpful, but this is really going to be something that we're going to need to learn a lot about as neuro-oncologists because this is not something we've necessarily needed to journey with to date. And then breastfeeding is also not recommended. So for getting pregnant, the current recommendation is that you don't try to get pregnant, obviously, while you're on the medication or for at least 3 months after you stop the medication. And then similarly for breastfeeding, no breastfeeding while you're on the medication for at least 2 months after the medication. And so these are, again, really big grappling challenges that we're going to have to figure out how to live with and managing when the right time is for these medications going forward.